Okay, so this voiceover lecture is going to review many of the interdisciplinary theorists, and this chapter is in your ebook, and it's chapter 41. With the exception of the medical psychobiological theory, all of these theorists should be a review for you in your Psych 101 or your other courses. But we'll go ahead and start with this outline. Okay. The first theory I have here is the medical psychobiological theory, and this looks at mental health, mental illness, looks at psychiatric disorders as a physical disorder. All right, so psychiatry is a physical disorder. And this theory would say that abnormal behavior can be attributable to a disease process, such as a head trauma, neurotransmitter abnormalities or malfunctions, genetic issues, the being exposed to certain toxins. Okay, so that's in a nutshell but everything can be attributable to a disease process, and they look at psychiatry or psychiatric issues as a disease process. So implications for nursing here: patients are going to be admitted, and insurance companies will reimburse related to psychiatric diagnoses, and those psychiatric diagnoses we find from the DSM-5. All right, so nurses must have thorough knowledge of psychiatric diagnoses. They must have thorough knowledge of the medical model, the signs and symptoms, etc. Also, nurses must have a very thorough understanding of psychiatric medications and psychiatric treatments. So that's very important with this model or this theory. The next is a psychoanalytical theory, Sigmund Freud, which most of you are familiar with. And again, we remember that his big emphasis is that the first 5 years of a person's life is the very most important. He talked about topography of the mind, the role of the conscious, and all of this should be review for you guys. I'm going to let you basically, take notes on this on your own. But the role of the unconscious, all memories are within awareness, such as your phone numbers, birthdays, that sort of thing. There's the role of the preconscious, where memories are not in awareness, but that you can recall those or have access to those quickly. If you think about it or spend a lot of some time with it. The role of the unconscious, this is where memories are you're not able to bring those to awareness, and memories that are repressed, and usually, he talks a lot about unpleasant and non-essential memories being repressed or in the unconscious. He also talked about structure of the mind and the personality structure, the id, ego, superego. You guys should know about that and make sure you know what those are. But just a quick review: the id is our instinctual drives, impulses. Our ego is basically our reality of the external world. Superego is our perfection principle. We are internalizing values and morals that have been set forth by our parents or as we were raised. He also talks about defense mechanisms and anxiety, and I already talked about that in, I believe, chapter 2. We talked about defense mechanisms, and we also talked about anxiety and how defense mechanisms, we talked about task-oriented responses to anxiety and defense-oriented responses to anxiety, and I asked you to know those defense mechanisms and examples of those defense mechanisms. So that's basically Freud. Okay. Freud also had the psychosexual stages of development. I'm not going to have, and those are 5 stages that he believes are influence our adaptation. I'm not going to have you guys memorize these. Implications for nursing practice, the psychoanalytical theory. we can use Freud's theory to help us recognize behavior and help us to recognize it if it's associated either with the id or the ego or the superego. Helps us to look at some of their developmental stages or developmental ages. It also plays a role in or influences our nursing practice because we can start to look at the client's use of ego defense mechanisms or those defense mechanisms and look at their responses to anxiety and help the patient determine if these are maladaptive behaviors or responses, and then how to develop more adaptive and task-oriented responses. Cognitive Developmental Theory by Jean Piaget, 1969. 4 major stages that he has related to the cognitive development of a child. You will probably look at this a little bit more when you get into your pediatrics course. But implications for nursing here are very significant. You're not going to be tested on these 4 major stages from Jean Piaget, but I do want you to know that the cognitive developmental theory definitely has implications for nursing practice. And we're going to talk about this more when we get into the unit on mood disorders, especially depression. But the nurse, we definitely help with techniques of cognitive therapy. For example, we know that a person who has many negative thoughts, we examine those negative thoughts to see if they are accurate or inaccurate. Are they rational thoughts or they're irrational thought? A negative irrational thought might be, I don't have any friends or nobody likes me. Okay, that's a cognitive distortion. I'm sure there is somebody that, some person who likes you or some person who has you are a friend with. Okay, so that's kind of that is a cognitive distortion. But cognitive therapy works on controlling those negative thoughts or replacing those negative thoughts with positive thoughts. So we will talk a lot about cognitive therapy later on in the course. Social and interpersonal theories. These are human theories that look at human behavior and would say that human behavior can be observed in social interactions. One of the main people here is Maslow and his hierarchy of needs and self-actualization. And again, I've asked you guys to, this should be a review for all of you guys, but you should know these stages. All of these stages and what fits into, all of these different hierarchy of needs. Implications for nursing practice. As you guys can probably tell me, it provides a framework for prioritizing care, and that until the basic premise, until basic needs are met, an individual does not pursue growth and actually avoid seeking development of further needs. And to the full potential. And this helps us to, again, like I said, prioritize needs, but also to put interventions at specific need areas. Theory of psychosocial development, Erik Erikson. Again, should be a review for you, his 8 developmental stages. You do need to know those. I have included a site here for a mnemonic for Erikson's 8 stages of development. If you haven't memorized those already, this might help you to memorize those. But it's very important that you do know those 8 developmental stages, what's going on in those 8 developmental stages. Implications for, well, let's see if I, so just a quick review. He says that individuals struggle with developmental crises. Okay, at these different stages, there's always a developmental crisis. And there are specific tasks that are associated with each stage that must be completed, okay, in order to get out of that crisis and in order to have emotional growth. All right, so the first, trust versus mistrust, that's the developmental crises. And we have to develop trust in order to resolve that crises and to move on to emotional growth and move on into the next stage. Implications for practice. Many individuals with mental health problems are still struggling to achieve a lot of these tasks from earlier stages, such as maybe even trust versus mistrust. Maybe there are people that are still struggling with that issue or are struggling with autonomy. Nurses can identify where patients are in these stages and assist the individual in meeting those tasks and moving on to higher developmental levels. Now, hopefully in your care plans from last semester, you guys have been working on looking at your clients or your patients and trying to identify what developmental stage that they are in, and many times that is by age, but then also to say is are they actually in this stage or are they in an earlier developmental stage? And we will continue that with our care plans this year as well. Theory of object relations. This is Mailer, who is a theorist. This theory describes separation and individuation process of the infant from the maternal figure. So basically, the focus is on separating of the child, usually in the toddler years, and how they separate and how that is a healthy developmental process for them. They also talk a lot about the reapproachment phase, but there are different phases. I'm going to talk more about this at the end of the semester, but you need to just have a basic understanding of it now. This object relations will say that if a toddler does not separate and become individual or have an individuation in a healthy way, that can promote or provide mental health issues later on in life or in future years, that they're going to be prone to mental health issues. So for example, one of the things that toddlers or 18 months, which is toddler years, that a child will start to identify themselves as separate from the mothering figure, and may start to play on their own, maybe start to walk away from their mother a little bit, play a little bit, maybe always looking back at the mom, but then come back to the mom to get security and to get reassurance that everything is okay. Now, in a healthy way, the mother, and I'll say mothering figure, the mothering figure supports this and helps the child with this, so that when the child goes away, the mother allows that. When the child comes back, the mother gives them support and helps them and lets them know everything's okay, and then they go out again and play by themselves a little bit and then come back to the mother, and they continue to do that. And hopefully that's going to be a healthy separation, individuation. But if a mother does not allow that, or if the mothering figure, again, it could be a father, it could be a grandmother, whoever is that parenting figure, if the doesn't support the child in that separation, individuation stage, they can have mental health problems down the road. So if a mother would hover over the child or not let the child go and play by themselves, or was really anxious when the child moved away from her, that might start to cause problems with that stage. Or if when the child came back, if the mother was unconsciously being threatened by the child moving away from her, if the mother then did not reassure them or did not support the child when he came back to her, then again, that could alter that separation, individuation stage and cause problems down the road. Okay, and again, we'll talk more about this, especially when we get into a borderline personality disorder. But implications for practice, we can assess the client's individuation from the primary caregiver. And as I mentioned before, emotional problems of many people can be traced back to this stage, to the separation individuation stage. And a person can have problems with depression, dependency, and excessive anxiety if this stage was not carried out or resolved. And like I said, the borderline personality disorder often is stuck in that reapproachment stage, and we'll talk about that later, as I said. Okay, stage is nursing theory, which is Hildegard Peplau, and she had the interpersonal theory to nursing practice, and this focuses on the nurse-patient relationship. And in our next voiceover, we're going to talk at length about this, but talks about the nurse-patient relationship and how the nurse uses his or her own personality as a tool to help the client. Implications for nursing practice. Basically, this theory provides a framework on how to interact with clients and to help clients. All right, so to make sure that you know the basics of all of these theories, and if I said to, like with Erickson, make sure you know all those stages. And again, this is probably review for all of you, but to make sure that you review these, know the basics, and if there are specific things that I said to memorize or to know, make sure that you know them.